I can't hear Denise. Denise, you're on mute.
That would be a problem. Sorry about that, guys. Good afternoon, everyone. We're about to get started. My name is Denise Gomez. I serve as the manager of community relations at Children's Health and also have the privilege of serving as the co-chair for the policy action team for the Dallas Coalition for Hunger Solutions. On behalf of the team and the leadership action team, we would like to thank you in advance for joining us for this important food policy update and advocacy training. To provide some context about the Dallas Coalition for Hunger Solutions, it is a coalition that is whose mission is to empower residents to gain equal access to healthy food. And since 2012, the coalition has been bringing leaders together who are engaged in the work of addressing poverty, hunger, and to take collaborative action. This work is carried out by 5 action teams focused on child hunger, faith, community hunger solutions, senior hunger, urban agriculture, and finally policy. The goal of the policy action team is to promote strong local, state, and federal public policies to improve healthy food access. The group does this by educating stakeholders like yourselves about important anti-hunger policies through education events, keeping the public informed about policy developments, and building relationships with elected officials to educate them about the impact of anti-hunger programs. Today, we are pleased to welcome Mr. Eddie Longoria. He is the Regional Division Director for Special Nutrition Programs with USDA and Nutrition Service for the Southwest region. In his role, he is responsible for child nutrition and food distribution programs in 7 states, including Texas. These programs include the National School Lunch Programs, Commodity Supplemental Food Program, Supplemental Food Programs for Women, and WIC. And he'll start us off with a presentation to help us understand the Child and Adult Care Food Program and the important role it plays in our community and how it is administered. Following Mr. Longoria, we will be joined by a wonderful ensemble panel that will be moderated by Katherine Nicholson, who serves as a regional director of the Texas Hunger Initiative North Texas office. And our panelists include Paula Watkins, founder and executive director of the Bridges at Fair Park, who runs a non-residential day program for adults. Sarai Ferreira, and Sarai, you can correct me afterwards. I apologize if I butchered your last name, who serves as a child nutrition program manager at City Square. And actively works towards providing free meals to children in our community as a child Cacfp sponsor. And finally, Sharon Ray, who serves as the president of NutriService and CEO of NutriServices, who operated a Cacfp program for 30 years and was the former treasurer of the National Cacfp Sponsors Association. So based on their bios, and that you'll get a full page of their bios, but we have definitely experts in our midst and are looking forward to learning from their insights. So Eddie, we're honored to have you and look forward to learning from you. So without further ado, I will give you the virtual floor and pin your screen.
Wonderful. Thank you, Denise. Can you all hear me okay?
Yes.
All right, wonderful. Well, hello, everyone. It's great to see you. It's been a while since I've had an opportunity to speak to many of you who are on the line. I saw a lot of familiar names when I scrolled through the names. So good morning and thank you for joining this important meeting. For those of you who don't know me, I'm Eddie Longoria, and I'm the Special Nutrition Program Division Director for USDA Food and Nutrition Service here in the Southwest region. So many folks ask, when we talk about regions, what does that really look like for USDA? And we have 7 regions across the United States of America. In the Southwest, we oversee 7 states, which are Arkansas, Arizona, Louisiana, New Mexico, Oklahoma, Texas, and Utah. That's a lot of states. On top of that, we also have 36 tribal organizations who administer programs like the Child and Adult Care Food Program, the Summer Food Service Program, the Food Distribution on Indian Reservations Program, the Women, Infants, and Children's Program, and other programs that serve food banks. So we work with quite a few folks out there, which is really good. I'll tell you, my duties have been expanded since the beginning of this calendar year. The SNAP director for the region retired. And so our regional administrator, Bill Ludwig, assigned me to not only oversee the special nutrition programs, but also, to oversee the SNAP program. So I'm overseeing all 15 feeding programs for USDA in the Southwest region of the US. It's a great thing because I get to make a massive impact in so many people's lives, and I look forward to doing it every single day. Excuse me. So these are just a few of our programs that are available to help reduce the burden on families who are worried about where and whether they can provide nutritious food for themselves or their children. Today, I'd like to share some information about CACFP and how we can use this program to assist feeding our nation's most vulnerable. But before I jump in, I want to recognize our partners and advocates like City Square, the Texas Hunger Initiative, and the Dallas Coalition for Hunger Solutions. We've enjoyed our longstanding partnerships with these organizations. Also, I'm looking forward to learning more about the Bridge at Fair Park Senior Living Facility. Can't wait. Sounds really, really exciting from what I hear. And it's important to share stories about places like the Bridge at Fair Park because we want to build awareness about CACFP and the families it helps and the impact that it makes in so many people's lives. Without data, we all know hunger is a real problem in our communities across the United States. The USDA's latest report on household food insecurity in the United States that was published in 2019 found more than 13.7 million households in the United States were food insecure, meaning they had difficulty at some time during the year providing enough food for all of the members of their household due to a lack of resources. That's more than 10%. As we've all seen, the pandemic has added urgency to the already critical issue of nutrition insecurity. And we have learned how much it has how much it has affected low-income families of color. We are working with our state agencies and partners to ensure those who qualify for these programs have access to nutritious foods that meet their dietary needs for an active and healthy life. In fact, right before this meeting, I just got off the phone with all of the child nutrition directors for the Southwest region, had some really good conversation about what can we do better? How are we focusing on underserved communities? Are we truly focusing on those in need? So we are really making some focused, direct improvements on trying our best to help those in need. CACFP aims to provide a nutritious and balanced meal to children and adults. So a show of hands, how many of you have children or have taken care of children? I'm just curious to know that because everyone should be raising their hand, right? In one way or another, you've either have a child or you've taken care of kids in one way, maybe your neighbor's kids, who knows? So you know how hungry they are almost constantly, right? Everyone knows that kids are it's like never ending. They're always hungry. I have two sons, one's 19 and one's 17. One's in college, one's about to go off to college. And they basically eat us out of the refrigerator. And I will tell you, when they were small children, it was the same thing. It hasn't changed. Now imagine you had no food when you were taking care of these kids, or only the cheapest food to give them. Food that wouldn't nourish them, food that wouldn't put them in the best health to move forward. Nutritious food enables good health. Nutritious foods are preventive medicine. I will tell you, I have visited many, many facilities across the Southwest region, really across the United States. And many of those facilities have been medical facilities. We have a very, very good program where we're able to bring meals to medical facilities. And I've talked to a lot of medical doctors, and they get it. They understand the importance that good food plays in good health. And so we have to keep that in mind. The Child and Adult Care Program is a federal nutrition program authorized by Congress and administered by the United States Department of Agriculture, Food and Nutrition Service. That's me. We partner with state agencies who turn to their partners with local operators. For instance, in Texas, the United States Department of Agriculture has an agreement with the Texas Department of Agriculture, who is a great partner. And TDA partners with local daycare centers or adult daycare centers across the state of Texas who sponsor to operate the program. And that's a great example of some of the great work that has taken place in our country. Texas is looked upon as one of the leaders when it comes to feeding those in need, but there's always room for improvement. Infants and children through the age of 12 in child care centers and adult daycare center homes are eligible to participate in CACFP. In after-school care centers and emergency shelters, children through age 18 are eligible for free meals and snacks. Adults who are 60 years or older or are physically or mentally impaired and enrolled in adult daycare are also eligible for CACFP. A lot of people don't realize that. They must be a non-residential service. It must be a non-residential service facility, and it must be based on income eligibility of the adult. There are so many there are so many childcare institutions, centers, programs that could be eligible to participate in CACFP, but they're just not currently. Family daycare homes are very common, but only a fraction participate in the program. In fact, I will tell you, it's interesting to me that when we go out, or when I go out, when I was going out prior to COVID, and hopefully we'll be going out soon again, and I talk to so many people who I just assume are aware of our programs. They have no idea, and they're operating, many of these families or many folks who operate child care centers in their home are eligible for our programs, and for some reason they just don't utilize them. And it really is a disservice not only to the child, but also a disservice to the organization that's running that program, because it affords them an opportunity to be reimbursed for those meals that they are serving, as long as they fit the criteria of the regulations. But really, it's a missed opportunity, and we really need to get that word out there. Many after-school care programs occur throughout communities, but don't have the budget to provide nutritious meals. Well, guess what? CACFP health programs provide nutritious snacks or meals to those children. So we can do it. We have the funding to assist those organizations. Please get that word out. It's important to understand that a variety of operators are welcomed into this program. From your large daycare centers like the YMCA or Boys and Girls Clubs, to mom and pop family daycare homes that are caring for a handful of children, to small city programs for disabled adults. We even have major hospitals that participate, as I mentioned earlier. These child care and adult daycare institutions or sites can receive cash reimbursements for serving meals and snacks that meet federal nutritional guidelines. In general, centers and daycare homes can be reimbursed for up to 2 meals and 1 snack per day to each eligible child or adult participant. Let me repeat that. Centers and daycare homes can be reimbursed for up to 2 meals and 1 snack per day to each eligible child or adult participant. That's a lot of food, and that's a lot of help for those in need. The institutions or homes are reimbursed per meals based upon the child or adult's eligibility for free or reduced price or paid meals. In daycare homes, all meals are served free. Daycare home providers who serve children in low-income areas or meet low-income eligibility requirements themselves receive higher levels of reimbursement. Daycare homes work through sponsors to claim meals. In CACFP, there are what we call meal patterns. And so I talked about a little bit about these regulations. This is a little bit about it right here, which are required food categories and quantities that need to be served. And they differ per meal, breakfast, lunch, or dinner, and age group. I won't go into the details of the requirements per age group, but there are different requirements for infants, pre-primary children, and school-age children. In each meal pattern, USDA requires children to be offered, excuse me, in each meal pattern, USDA requires children be offered all or a combination of milk, fruits, vegetables, meat/protein, and whole grain carbs. It all sounds delicious, and we all know those are very, very good things to add to any meal. The goal is to provide a balanced meal with a variety of nutritious food items. The thing I want to emphasize the most, though, is that CACFP is a program that seeks to assist communities in shouldering the cost of providing nutritious meals to children and eligible adults in a daycare setting. We would love to see you help the children in your communities by participating as a sponsor, a site, or even as an advocate. When I talk about getting that word out, be that advocate for that program, for all of USDA's programs. Thank you to the Dallas Coalition for Hunger Solutions, the Public Policy Action Team, for allowing me to speak today. But before I close, I also want to mention a few other resources that you all may find beneficial for the people you serve. Recently, the Federal Communications Commission launched a new temporary benefit where low-income households can receive $50 a month, or if you're on in tribal lands, it's $70 a month, credited towards broadband services. Everyone knows that broadband services are very much needed in rural communities across the United States. If you want to know more information on this, you can visit the website, which is www.getemergencybroadband.org. Let me repeat that. www.getemergencybroadband.org. I also recently, Health and Human Service announced that they have extended the special enrollment period for people to sign up for medical coverage until August 15th of 2021. Those interested can visit www.healthcare.gov. Once again, www.healthcare.gov. Let's continue doing the work to lift children out of poverty. We can all do this together if we do our part. Get that word out. Become a sponsor. Become a site of one of our programs. I look forward to working with you in the future, and thank you so much for allowing me to have a conversation with you all, make you more informed about the CACFP program. And again, my name is Eddie Longoria. I'm very, very proud and happy to serve all of you and all of the folks in your community. So with that said, I will turn it back over to Denise, I believe, and thank you all again.
Thank you, Mr. Longoria, and thank you for that very informative presentation. I think we definitely needed a level set because, like the title of this panel, it is a very long name, but it's a very important program and people need to know about it. So I appreciate you providing some insights on how it's administered and really setting the stage for our panel discussion that will follow. There is a question that I definitely want to make sure gets addressed. That was brought in by Tasha Baker in the chat. She's aware of the CACFP program, but she's also heard that there are barriers to service when starting the process to join. Have any of those steps been streamlined at all? And can you address that question for her?
Sure. And thank you very much for that question, Tasha. I think you bring up a valid point. I think that many organizations feel that there are barriers that are in place, but I will tell you, in Texas, the Texas Department of Agriculture has a phenomenal website. In fact, it's one of the best in the country that addresses many of the questions that you all may have in becoming a CACFP sponsor or site or participant. And I will say that if you have not had a chance to visit their website, I highly recommend it. Because there's probably a lot of information on there that you sometimes see. Even I look at it sometimes like, I didn't even realize that this is one of the things that we could utilize. So I highly recommend visiting the TDA website, also visiting USDA's Food Nutrition Service website. And at the end of it all, if you have any questions or concerns, I'm going to put my email address out there. I'm going to actually put it in the chat if I may. It's very simple. So it's eddie.longoria@usda.gov. Now, I will tell you, I have a lot on my plate, but I want to do everything I can to assist those in need. And I say that because many of you may know this or may not know this about me, but I grew up in a very, very low-income community of Los Angeles, California. And I utilize many of the programs that I currently oversee. And so I know the impact and the difference that these feeding programs can make in so many people's lives. And I'm a result of that. And so I want to do everything I can to assist you all in any way possible. So if you can, I highly recommend that you go out there and you look at those websites first. But if for some reason you continue to see barriers, you continue to see issues, send me an email. Let me know that you talked to me today in this announcement, in this presentation, and I'll follow up and try to get you an answer as quickly as possible.
Thank you, Mr. Longoria, and we appreciate you again for setting the stage. At this moment, we're going to move forward with our panel discussion from some very important CACFP sponsors and providers. And Katherine, I'm going to go ahead and pass on the virtual floor to you and also pin our different panel guests.
Thank you, Denise, and thank you, Eddie. Like Denise highlighted, it's a long name, and there are a lot of technicalities with the CACFP program. And your presentation really helped give us a great stage. And actually, your comment about your family and growing up in your situation is a great segue into our first question. And so I'm going to ask Paula to answer first, and then Sayuri, and then Sharon. But our first question for our panelists today is, why does CACFP matter?
Well, first of all, thank you for having me. I just want to give a little bit of background. We are the Bridge at Fair Park Adult Daycare. It's a daytime program. We've been doing this program since 2006. And let me just diverge a little bit for the individual that asked the question about, she knows about the program, but it's been some barriers. Well, that's how I felt at the very beginning. But now, I know in Region 10, where my center is located, there are technical assistant office that will help you with your application. They will come out on site or do virtual training. They will help you get ready for a monitoring visit. And right now, the summer school program application is out there if you want to do a summer school feeding program, as well as the child and adult care program. The applications are out there and they have deadlines. I believe the CACFP is due September 30th. But anyway, so I guess, what are the barriers? Is that what you want me to address right now?
Why CACFP matters? You serve an adult daycare, an adult care facility, which I don't think gets highlighted enough as being part of the program.
Well, it definitely does matter, because the CACF program supports the health and wellness of not only children, but individuals with disabilities and the elderly. And a lot of people are not aware that for the adult program, they can be as young as 18 years old and no upper age, but it provides nutritious meals and snacks to individuals. And many of these disabled adults and elderly, without this program, they may not have a nutritious meal during the day or into the evening, because they're maybe left alone at home. Their families must work to be able to take care of them. Not only do they get nutritious meals, but the meal patterns are really regulated with the different components that we must provide to make sure that they're healthy. And so it matters, because they're not just having cold food all day or no food. And they're coming to a controlled environment where I know my facility, we have a dietitian that really is up on all of the regulations that keep us regulated and on board and in compliance with the meal patterns. So as I said, without these programs, the breakfast that they receive here, the hot lunch, the snacks that they receive, they're all very important, because for many of them, that's all the food they're going to get for the day. And we've implemented one other thing for the last three or 4 years, maybe a little longer. We've been working with with Baylor Scott and White, the Diabetes Health and Wellness Center at Juanita Craft, which is here in South Dallas. They provide a farm stand, And what we do is we order from the farm stand. The individual participants order from the farm stand. We pick the food up. Now they're delivering the food because of the pandemic, but they deliver the fresh fruits and vegetables, and we get them on Friday. So the participants can take this fresh fruits and vegetables home so that they can have that for the weekend. So that's a wonderful addition to our program. And they look forward to getting their bag of fruits and vegetables to take home for the weekend.
That's absolutely incredible. About the partnership, I think that's fantastic. And you were correct in that it is most of the time the 2 meals that a member may get. Sayuri, would you like to tell us a little bit about your program and why does it matter?
Hi, everyone. I'm Sarai Ferreira. I know it's kind of a hard name to say. I just wanted to get it out there. So as it shows there on the bio, I'm the program manager for child nutrition programs at City Square, and we run Cacfp at Risk. So that's specifically the after school meals program. So we provide meals to existing after school programs. And like Eddie mentioned, it's a great way to provide free meals. That way it doesn't have to come out of the child care's budget. So it's amazing that this program is available to them. And why it's important, specifically to me, as a child that grew up on free and reduced lunches, and I was a WIC baby, I was a SNAP baby, you know, I grew up with all these programs too, and now here I am running it. And Cacfp at Risk specifically just turned 10 years old. So I wasn't actually able to benefit from this program specifically, but I'm so happy that it's available now, because for too many children, the lunch that they receive at school, that free lunch, may be the last nutritious meal that they get for the day. So to have somewhere safe to go after school and receive a hot supper, we all know the difference that can make to a child who's still trying to finish their homework and just develop still. So it's one of the, supper is very important. They say breakfast is the most important meal of the day. Well, I wouldn't want to go to sleep on an empty stomach. So I just think it's so important to have this program. I have other things here. I think that was my main thing. I'm just so happy that it's around. And I wish it was around when I was in school, because I know my mom would have benefited from it, being a single mother. So I'm just so glad to be able to offer this program. And as other people mentioned, there are a lot of barriers to get onto this program, but one of the easiest things you can do is look for a sponsor. There are a lot of sponsors, especially in Dallas, that are just here waiting to provide those meals to your site. So if you can't get to the application process, there's too many barriers. I know viability and all that can be kind of hard to get through. Look for a sponsor and we'll be happy to bring you on board and provide those meals for you.
And Catherine, if I may, Sarai brought up a very good point, and I just wanted to stress this. I used to also hear many times that breakfast is the most important meal of the day. But what I have learned is that for a hungry child or a hungry elderly person, every meal is important. It doesn't matter what time of the day it is. It doesn't matter when it's being served. Every meal is important for someone who's hungry. So just wanted to stress that, and thank you very much.
Thank you.
Yes, thank you. And I think you brought up another excellent point, that the at-risk component of Cacfp is only 10 years old, and that it has been an instrumental expansion due to the last CNR that we had. And I think we can talk about that a little bit further later on in our panel with our panelists, but I would like to give Sharon an opportunity to share a little bit about her organization and why Cacfp matters.
Can you hear me now? Awesome, thank you. So NutriService is sponsored. We are sponsors of the Child and Adult Care Food Program, and we've been around for about 30 years now. Sounds like a long time. We sponsor home daycare providers, and we sponsor adult daycare, and at-risk after school and child care centers. So the only, I guess it's easier to say, the only thing we don't do is summer food. And the reason that it matters is because all of the people who provide services need the support that they get, not just the financial support, but also the education, the outreach. The children benefit directly because we try to educate the providers of the program. And that's one of the tenets, really, of the food program, is that you're encouraged to train. And so the more we talk about nutrition, the more we make nutrition a topic in childcare and adult care, the more the benefit is extended and received by not just the children, but sometimes even the families of the children, when we're able to do outreach, the way we like. And so I think it matters not just to the recipients, but it matters to everyone, because we're trying to lift, the high tides.
Yes, lifting tides, I think, is the common goal of all providers. But it's a phrase I really particularly like. I'm going to move us into our second question. And I did want to offer a brief, quick correction on my part. When I say CNR, I say that means Child Nutrition Reauthorization. And we can, again, discuss this a little bit further, but just so there's a lot of acronyms, and when you're in the business, I feel like you say them all the time, and you kind of forget that when you're speaking to others, they may not know those acronyms. So just a point I wanted to correct. But moving into our second question, we had a question from Roseanne asking about cooperation with parents and guardians, which I think segues to what are practitioners doing to implement CACFP and help families. And so I think that plays into a bit about the parent cooperation with parents and guardians. And so Sayuri, I'll let you start first, and then I will pass the baton.
Thank you. So one thing I think is really important is just to meet families where they are. So we partner with a lot of schools, churches, clubs, and recreation centers. And these are places where families already feel safe and secure, and they already feel comfortable bringing their children there. So we think it's really important to partner with people already with those connections in the community. That way they're already familiar with them, and they can go there and receive that nutrition that they need at the end of the day. I believe, yeah, that was just the first question, right? I know there's more to it, but we'll get to that part later.
Yes, no, there is more to that question. But I think it's easier if we just answer that part first, and then I'll ask the next parts of the question. So Sharon, if you would like to answer about what practitioners are doing to help implement CACFP and help families, and about cooperation from families.
Sure. So most of the time cooperation is not an issue, because most families appreciate the help, and they also appreciate more than one agency interaction. So for an example, as sponsors of the food program, our job is to monitor our sites. And so we'll do unannounced visits, we'll do monthly trainings, and we'll help foster that communication between parents and the providers. Some of the trainings that we provide are actually trainings that they can give to the parents of the children, or to the guardians of the adults. So it's not, there's communication there. It's not direct communication, but we encourage the participation questions, and of course we always have the posters and flyers that notify parents and guardians that their operator is participating in the food program. Hope that answered that question.
No, that helped. Paula, would you be able to answer to implement CACFP and help families in the cooperation component?
Yes, well, my part is dealing with adults, and even though they are adults, none of them live alone. They live with either their family members or another caregiver. And so a big part of what I have to do with implementing the program is to make sure that they are aware of our meal pattern requirements. I try to do a food diary. Well, a part of our activity is a food diary. So we keep a food, each individual will keep a food diary. They can also, when they first enroll, we send a checklist home, or the individual can complete a checklist of what they like and what they don't like. That helps us in planning our menus. Now, the other big part of communicating with the families is the annual requirement for them to let me know what their income is, because that will determine, whether the reimbursement is free, reduced, or paid. Surprisingly, I have had a few family members and individuals that didn't want to give me that information, and I have to explain to them that I need to have that information. They think it's an intrusion or, interfering with their privacy. But once I make them understand that they have to provide that because I have to get that information, then they comply with it. So, but I guess my two main concerns is just making sure we're in compliance with the regulations, and that we're monitoring all aspects of our program. We're addressing our menu planning. We're trying to control our cost. But the communication with the families, it's pretty straightforward. One thing that I do whenever the newsletters come out on Square Meals, they publish newsletters frequently, at least once a month. I print those out and send them home because it has all kinds of tips on buying food, on selecting food. One big thing that's coming to mind right now is the milk requirement. And I'm pretty sure some of you all have, well, you may not have heard about the problem with the milk requirement for adults. They don't like milk, but we have to serve them milk. And, there's some milk requirements for breakfast and for lunch. And we have to provide the milk to them, whether we have to offer the milk to them. That's a big concern. The only way we can get around not giving them milk is with a doctor's statement, or if they're lactose intolerant, we have to give them something else. But, as far as dealing with the families, they do get newsletters from us. They love the farm stand where they bring home fruits and vegetables. And they do, this is the one thing that they pay for. We get a list of the offerings, and everything is like $1. So you might get 4 big sweet potatoes for $1, or a bushel of strawberries for $1, some limes for $1. And the family members get the order list. They fill the order list out, they send me the money, and I order everything, it's delivered, and they take it home. So they love that component. There's no other cost. They don't have to pay any money at all for the meals that they're served at the center. So I don't really have a big problem with the families. They like getting our newsletters. They like being informed about our birthday parties and our celebrations like that. We used to have the family members come in and have lunch with us pre-pandemic, but now we are not doing that, and they understand why. So they're fine with that.
No, I think what you highlighted, Paul, is really important, is that communication with families, and that being a big process of implementing CACFP, so they understand the service they're receiving, but also allowing them to have some say in the service they receive as well, with the diet choices and things like that. I'm going to jump into the second 2 parts of this question, which are with implementation does come barriers, but there also are opportunities within those areas to implement in those barriers. And so, Sharon, I'm going to ask you first to expand upon a bit, what are some of the barriers for CACFP and what are some of the opportunities with implementation?
Oh, gosh. Okay. Barriers. Without getting too deep in the dive, you know, there's a lot of paper. There's a lot of paperwork, and we're still, you know, we're still doing things that we did 20 years ago as far as collecting paper and applications and enrollments. And one of the barriers that I think would be easily solved is if we did not have to input monthly eligibility ratios, if we could get a snapshot maybe annually of whatever the free, reduced, and paid ratio is, and just have it across the board until we, you know, choose to renew or submit different numbers. So in other words, in August, you could get a free, reduced, and paid ratio, whatever it is, whatever your snapshot is in that site for that month, and let that extend all the way through the year, because you'll find that the ratios don't change too much. Someone doesn't go from 80% low income to 60% low income the next month. It's pretty stable ratio. And if we didn't have to recalculate that every month, I think that would eliminate, especially for single sites. You know, as a sponsor, that's not, it's not a real issue for me because we do a lot of stuff electronically, and that's one of the things that we capture electronically. So the computer does all that work, but we are still having to renew and have annual renewal of the paperwork and have paperwork as we go along. So I think that's one of the barriers. I'll tell you the other barrier that I've long thought we could really improve the CACFP if we had more interagency communication. And so the agencies that are involved in childcare and adult care, it's licensing, code enforcement, it's a workforce, right? It's health and human services. I mean, you could go on and on about the agencies that affect what we do on a childcare basis. So, you know, for example, workforce is already involved in CACFP because they supplement the childcare, right? They help pay for childcare for disadvantaged people. And workforce could jump in there and do some job training so we could increase our home daycare provider population. So just places that it's tied, that we don't really get the help, and sometimes we get a little obstruction. Code enforcement, you know, from city to city. Sometimes you can't operate an at-risk after-school program because you can't get your city code enforcement's uniform. So little task, I think a task force that involved all those agencies that maybe could meet, you know, every quarter, I think would be very beneficial. It would help us know what each other's doing and help us, you know, rise the tide again.
Yes, I think paperwork may be a common theme here that we'll hear from both Paula and Sayari. And I think that interagency communication as well. I've worked also with summer providers, and that tends to be a similar barrier there as well, an opportunity.
Yes, and Paula, I want to say I feel you on the milk.
Yes, well, you hit a nerve when you talked about code enforcement, because we had our fire inspection yesterday, and my jaw dropped and I wanted to quit. I can't quit because I own the business, but the fee for the fire inspection went up from last year from $200 to $700. And I did have a violation with which I've been doing this since 2006, and we've always had cutesies hung up in our activity room because a lot of my participants are autistic, and the visual stimuli help them. And I used to be a teacher, so I'm very big on decorating and things like that. Well, the fire marshal came in and said I had to take all that stuff down. And I'm like, okay. But you know, the different code compliance people that come in, one agency says you could do this, another agency says you can't do it. So it's like really trying to figure out, who supersedes who, it's very difficult, but we're trying very hard to comply. So we comply on this end, and then on the other end, they'll come in and say, you can't do that. So then we have to undo it. And I just, the thing about the fire inspection going up that much, I looked at their list of prices. The adult daycare price was the most expensive on the whole list. For an example, if you deal in fireworks and just fires, like fireworks, that the inspection was $175. So it's a disconnect. It's a very big disconnect, and we're not making that kind of money to pay for that kind of thing. I guess while I'm talking, I'll talk about some other barriers. The paperwork, everybody can acknowledge that. I like to have everything electronic and digital, but some of the forms will not let you be digital. You have to handwrite it in. If you try to make it digital and everything is digital, I did that one time. I created my own form. I made it digital. Luckily, I had the backup written copy because that's what the monitor required. She did not want to see the typed version. She wanted to see the handwritten version, and it's just a lot. And then the meal benefit eligibility form that you have to fill out every year. You can type on part of it, but the other part you cannot type on. You have to print it out and write on it. And so just little things like that, making your PDFs that you have to fill out editable, would help a lot. There's mountains and mountains and mountains of paperwork. And we do it, I farmed out certain things to different staff members. I have one staff member doing the attendance. I have another staff member doing all of the meal count, and when you're serving the meals, going around and filling out that paperwork, and that's just for the food program. But for the adult daycare program and the veterans program that I have veterans here, there's equal amount of paperwork. And so if these agencies could maybe coordinate, just like Sharon said, that would help us, and it would not be as a daunting task. And I can tell you, being transparent, when I'm getting monitored, it's the time that I want to quit. I always come out with flying colors with the monitoring, but it's very stressful. You want to get everything done correctly. The other barrier, I believe, is the reimbursement rate is not keeping up with what our actual food cost is. For my facility, we prepare all our meals on site, which I think if I had to order the meals from a vendor, I wouldn't be able to do it, because we're getting our raw goods wholesale from Cisco, from a supplier. However, if I had to pay a vendor for my meals, I don't think I would, I wouldn't be able to, because they would charge, more than what, they would charge more for, we get $1.89 per person for breakfast, $1.89. For lunch is $3.51. Well, I had checked into a vendor of what they would charge us for lunch, and they charge us $6.50. That was last year. So we built a commercial kitchen. That was another headache, dealing with the city, with the permits and all of that, but we got it done. And that was a big expense, and we're still paying for that commercial kitchen. But in the long run, we're able to prepare all of our meals on site to try to, save a little bit of money. But, if Eddie, if you're listening, if you could give us a raise somehow, that would be great.
Yeah, I appreciate the honesty, Paula. I've heard these before, and I think it's worthwhile to call attention again that there there are a lot of nuances with operating this program. It is, there's a lot of technicalities, and so, and we need things to move as quickly as inflation is increasing. So sorry, can you please quickly provide some barriers and opportunities, and then we'll move on to the next question.
Yeah, for sure. So some barriers for the at-risk program that I've been seeing are some of our partner sites that would like to be partner sites have a really hard time signing up. So like getting that childcare license or exemption letter from Health and Human Services can be really daunting for some of them. I've even started, like, I even have a contact there now where I like try and pair them up, and I'm like, hey, this is what they're trying to do. I'm not in Health and Human Services, you know, I can't answer like all their questions. So if we could have a little more communication there, an easier route for these would-be partner sites to get that exemption letter so that they can sign up for the program, that would just like break down so many barriers for our sites. Another barrier I've seen is more for our partners, and that's lack of funding for them, specifically like for the childcare providers. They're very, like, some of them are really small apartment communities that have like this small little after school care program on site. So if we could kind of spread the word and say, you know, these small like after school programs need more funding. Sure, the meals are free, but childcare isn't free. So they definitely could use a lot more help in that sense. And just getting the word out there is another barrier. Not enough after school programs and after school providers are aware that there are sponsors here that are willing and able to provide these meals for them. And I wanted to touch up on an opportunity that I was reading the No Kid Hungry report from last year, specifically on at-risk meals, and how sadly in 2019, only one in every child, 1 out of 17 children that received free and reduced meals also received a supper that they could get from an after-school meal program like Cacfp at risk. 1 in 17 is too few, in my opinion. In Texas, we're closer to 8%, but that's still not enough. So that is definitely an opportunity for growth there. The program has gone up, like increased by 600% since it was written into law, but we still have a lot to go. I feel like every child that receives that free and reduced lunch should also have an opportunity to get that free supper at the end of the day. So the more we can get it out there, the better.
No, I think all three of you highlighted some really great opportunities. We did have a quick question in the chat about, are there meal options for those who are vegetarian or vegan, or have other dietary needs or considerations? And would one person like to answer that really quick? I think that's usually typically an option, but I don't want to speak for you.
Sure, I could answer that really quick. There are always options for substitutions as long as you're in for example, in the meat category, there are beans and cheese and yogurt, eggs, etc. So you can always substitute. The one place you cannot substitute, however, is, say it, Paula.
Milk.
Well, the milk,
Sarai's got it. Milk.
yeah, milk,
Drink
so
milk.
that milk is something else.
Yeah, it is so hard to find a good substitute because you have to meet that protein requirement, and so many alternative milks just don't meet it. And
We could include the almond and coconut milk industry and tell them to start fortifying it to be identical to milk so we could offer it. That's the next session. Right, Catherine?
Yes, that is.
There's also an opportunity if you have, a cultural requirement because of your clientele, cultural meals. I believe you can get your menu approved by TDA. You would have to get that approved to deviate from the meal pattern requirement.
Well, thank you all three so much. We are running short on time. This has been a fantastic discussion. And of course, again, it's a big name and a lot to discuss. I think moving forward, this has been great for us to learn and how to maybe better appropriately advocate moving forward. It sounds like there are a lot of providers who could participate in this program who are not, and it would be worthwhile for us as individuals to, when we hear of a program that could qualify and could do this program, we encourage them to go to squaremeals.org or get in contact with our Region 10 or Region 11, their Education Service Center, to see about them becoming a sponsor. And it also sounds like there's opportunities for us to advocate for some streamlining of paperwork and communication, and allowing some of those barriers are nuances that are important for compliance, but maybe there's a better way for us to streamline that process to make it easier for our providers. But thank you all so much for your insight into the program. Thank you for the work you do in operating it, because it is not an easy program to operate, and we appreciate your dedication to ensuring that our Dallas citizens and North Texas citizens are getting food access that they need. So thank you so much to the three of you, and I'm going to wrap us up and pass it to Denise.
Thank you.
Thank you, Catherine, for leading us in a really awesome discussion with our local Cacfp providers. I do want to just thank our speakers and our panelists again today. Because we are running it short on time, I'm not going to cover one of the slides that really focuses on an update on bills that were passed during this legislative session. However, you will receive information and all of the completed slides in a follow-up email. So rest assured that you'll be informed about what happened during this last legislative session, but due to lack of time, we just won't be able to cover that. However, I did want to make sure that we highlighted this opportunity. We didn't just we want these forums and these roundtables to be informative, that you learn something new, but also that you are encouraged to actually take action on some of these items that you're learning, these new programs that really need support. And so there is a call to action that we would love and encourage you all to take. Our friends in Washington, D.C. Called the Food Research and Action Center do a great job at advocacy and really advocating for anti-hunger programs, including the Cacfp program. And they have a campaign going on right now that you can join and support. So if you found this program informative, take it a step further and really take a minute once you receive the link to the program to really take action and send a note to your legislator and just say, I support this program and why. And they make it really easy. When you follow the link, it'll provide you with step-by-step instructions on what to do. So really encourage you guys to check that out when you receive that follow-up email. And looking forward to seeing everyone again. We host these forums every quarter, and we'll be sending a communication email when we organize the next one, but hopefully this is not the last time that you join us for one of these, and and really encourage you all to continue to keep your eyes and ears open for advocacy opportunities to promote some of these programs that really need a lot of support. Again, thank you to our panelists, and Catherine, thank you for leading the discussion and with our guest. Appreciate you all and looking forward to seeing you guys again. Have a great one.